So let's just talk about knee pain for a second. Very commonly, knee pain gets blamed on meniscus tears. Now, what we find a lot is that if there's a massive meniscus tear where it's like flipped backwards in there, it's literally like flipped around and it's blocking movement, yeah, that's a major issue and you need to see the ortho about that. But if there's minor tears in there, that's normal with time and aging. And even if there's some arthritis in there. And what happens is people blame the pain on that when in reality, it can be something so simple as the joint is a little tight and every time it tries to get straight like this, it can't because there's so much restriction back there and it can't get to the fully straightened position. Or maybe when you try to bend it, it's getting caught or it's out of position. And that's because there's some tightness in the knee. And as soon as you stretch the knee in the direction it needs to be stretched in and you get things aligned again, the pain goes away. And so you can't get caught up on, is the pain coming from my meniscus or this or that? You need to be evaluated and see, is the mobility of the knee normal? If not, let's get it normal and see if the pain goes away. Once you get it to a position where it's perfectly normal, if you're still having pain, then we would have to investigate a little bit more.